Okay, so what is the broken ruler story? So when I first started Pursuit, it's a cash-based clinic. As some of you know, when you're cash-based, you have a lot of pressure to deliver, and sometimes we want to do what's best for our patients, and we put a lot of pressure on ourselves, thinking that we have to get results, and it's all up to us to get these results. So I was talking to my pastor, and I was like, "Yeah, I'm feeling a lot of pressure. I'm charging people cash thousands of dollars, and I'm not getting the results I want. And I'm doing this, I'm doing this, I'm doing this, I'm doing everything right, but I'm not getting the results I want." And it was frustrating at first. All of us go through that whenever we just start doing cash, especially going from insurance and then going into cash. We have all this pressure on us. So he was like, "You see that ruler there? Pass it over to me." So he passed it over to me and he said, "This is where you're at with the patient, and this is the end result. This is where they want to be." And he passed it to me and he said, "Break it." I was like, "What?" And he said, "Break it." So I broke it. He said, "Put it up like this. And this piece is what I'm responsible for. And I can only hold myself accountable of doing what's best. And if I know I'm doing the best, I can get them to here. But the other part of the ruler goes here." And he's like, "You're not responsible for this part. This is their responsibility in order to get to that end outcome. So it's not all on you to get that end outcome. You're responsible for this part of the ruler, and the patient's responsible for this part. It has to be a team to get that end results." And he was like, "It's unfair for you to put all that pressure on yourself when the patient has some responsibility." So that was like I tell students this all the time too. So, and they love it because, again, in a cash-based clinic, you have all that pressure on you to kind of deliver because you're asking someone to pay thousands of dollars for treatment. So why am I even telling you this? Because yesterday, sometimes when you're dealing with complex cases or you're running into a position where a patient just spent thousands of dollars and they feel that they're not getting the results they want, and they're self-sabotaging the outcome. This is why I'm telling you this now, because just yesterday I saw a patient who has insertional Achilles tendinopathy. She's responding good, but she's not getting results fast. And literally, it's only been 3 sessions so far, and she's had insertional Achilles tendinopathy for like 12 months. And she came in yesterday and was like, "You know what? I don't think it's working." After 3 sessions, her pain in one was down to a 0, and the other one was down to a 3. And she came in, she was like, "Yeah, I wear sandals the whole week." She didn't have her shoes with the heel lift in. "I played pickleball and my pain was like a 6, and my other one's a 3 now, and I just don't think treatment's working." And it's like in my head, I was like, ding, 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 ding. It's like, what is she doing? She's like self-sabotaging it. So every now and then when you're dealing with cases like this, you're gonna have to go back and tell the broken ruler story. And we had to go back and do the broken ruler story with her yesterday. And I was like, "Listen, this is where you're at, and this is where I'm at." I actually used to have a broken ruler here, and I used to pull it out and show patients this and tell them the broken ruler story. "This is what I'm responsible for, and this is what you're responsible for." The clean lady actually thought it was garbage, and she threw it out, so I don't have a broken ruler anymore. But yesterday, we had to sit down and talk and be like, "Listen, this is where you're at. This is where we want to be. The plan is this, this, and this," and I go through the 5 stages. "This is what I'm responsible for. This is what you're responsible for, but you're not wearing your shoes. You're not wearing your heel lifts. You're still going out trying to play pickleball." And she's like, "It's driving me crazy that I can't walk," because I told her to stop walking, because every time she walked, it would just flare up. But I was like, she needed like a come to Jesus talk, where this is the broken ruler story. You and I are working together as a team to get this. But she has to do this part, or she's never going to get that, because she wasn't listening to the plan. She was just irritating her Achilles every single time, and she's not getting the results you want. So I tell you this story just because you can use this when you're dealing with patients like that in a cash-based setting, if they're not getting the results they want, and you find like they're almost self-sabotaging. They're not doing it on purpose, but they're not listening to the plan, and they're just frustrated. Use the broken ruler story next time so they understand that it's a 50-50 game or 75-25, but they have a responsibility in getting their results too, and it's not just all on you. So next time you're done with that, think of the broken ruler story, and I hope it helps. Thanks.